Hi, I'm Dr. Rajesh Sachdeo, a board-certified neurologist specializing in seizure disorders and a member of the medical staff of Penn Medicine, Princeton Health. Today, I'm going to talk about epilepsy, the signs and symptoms, causes, and treatment options. The Centers for Disease Control and Prevention estimates that 3 million adults and 470,000 children have epilepsy, roughly 1% of the population. Many more remain undiagnosed or will have an isolated seizure at some point in their lives, which isn't considered epilepsy. A seizure is a burst of uncontrolled electrical activity between brain cells that causes temporary abnormalities in muscle movements such as stiffness and twitching. In addition, during a seizure, a person may have loss of consciousness or awareness, confusion, and changes in their vision. What someone experiences during a seizure can vary greatly from person to person depending on the area of the brain where the focus is. When a person has had 2 or more seizures with an unidentifiable cause, they are diagnosed with epilepsy. A seizure can last from 30 seconds to several minutes. An episode that lasts longer than 5 minutes is considered a medical emergency because permanent damage can be done to the brain. That's why it's essential to find the cause and implement appropriate treatment in order to reduce the probability of seizures recurring. Therefore, it is extremely important to have a medical evaluation, even for a single seizure episode, to find the cause and treatment if needed in order to reduce the risk of future episodes. During an exam, your doctor will discuss your health history and may test your motor abilities, mental function, and order a blood test to check for infections, genetic conditions, or illnesses that may be associated with seizures. If you have epilepsy, it's common to have changes in your normal pattern of brainwaves, even when you are not having a seizure. A test called an electroencephalogram, or EEG, records the electrical activity of the brain and may help your doctor diagnose what kind of seizures you are having and rule out other conditions. During an EEG, electrodes are attached to the patient's scalp with a paste-like substance, or you put on a cap. The test can be performed for a short period of time, such as an hour, or your doctor may prefer to monitor your brain activity for up to 24 hours or longer. Your doctor may also monitor you on video while conducting the EEG, and the test may be performed while you are awake or asleep. An EEG can be performed in a doctor's office, in the hospital, or you may be able to wear the EEG cap at home while it records over the course of a few days. Your doctor may also order an MRI scan to view the structures of the brain to help him find if there is an underlying cause for your seizure activity. Seizures caused by epilepsy can affect anyone, both males and females of all races, ethnic background, and ages. Epilepsy can also occur at any age, but is most common in children under the age of 3 and in adults over 50. Seizures in children are most often related to injuries, infection, or a genetic disorder. In adults, seizures can be caused by a stroke, brain tumor, or aneurysm, or as a result of degenerative disorder such as Alzheimer's. Other factors that may cause seizure activity in adults include hyper or hypoglycemia, changes in the blood sugar levels, sudden alcohol or drug withdrawal, high fever, lack of sleep as a side effect of certain medications, stroke, infection, head trauma, and brain tumor, and as a symptom of some autoimmune diseases such as multiple sclerosis. Seizures can also be genetic in origin and may skip a generation. Following an epilepsy diagnosis, management may involve treating the underlying condition that triggered the episode, taking anti-seizure medication, and in cases that aren't able to be managed through medication, surgery. Dietary changes such as following a high-fat, high-protein, low-carbohydrate diet, often referred to as ketogenic or keto diet, may also help control seizure activity. Regular monitoring and adjustments of medications as needed is important in managing epilepsy. For some patients, it takes time to find the most effective and best tolerated anti-seizure drug or other treatment approaches. The ultimate goal is to stop all seizures. With appropriate care, seizures can usually be successfully controlled and patients can focus on living their normal lives.